How much chiropractic care do you need? Well, of course, it does depend. There are many reasons that will determine how much chiropractic care you need. If you're, like most people, a lot of people will come into a chiropractic office with acute neck pain or back pain, headaches, migraines, arm and leg pain, maybe a hip problem or a knee, shoulder, that kind of thing. That's how a lot of people find themselves in a chiropractic office. One of the first questions that we try to answer for people in the first visit or two or three, how long is this going to take? Well, I can give you a range right now. I've been a chiropractor long enough to have many people that have had a one treatment or one adjustment miracle, where somebody comes in with a long-term problem, I work on them once, problem is solved, never to return, okay? Unfortunately, I don't have the power to do that in everyone. Sometimes that does occur. Unlikely in most cases, but miracles do happen. On the other side, if you read my patient Gail's testimonial on her chronic low back pain, right now she's 75, so this is back when she was 70, she'll say it took me 3 years from the point I was devastated and I could only stand for 2 hours a day and the rest of the time I had to lie down and I had to take early retirement and I couldn't do anything, to the point where I can say I love my back. Gail will say that was 3 years. So here's the range, 1 day to 3 years. Okay? Most of you probably won't be a day. Certainly most of you will not be 3 years until you get to the results that you're looking for. Okay? Now, if you're the typical person that comes in with acute neck and back pain, think of it like this, a sprained ankle. If you have a sprained ankle, you know that you're not going to get better today. Even though you'd like to get better today, and your therapist would like you to get better today, and your doctor, you're not going to get better today, but we can probably give you a range. A milder sprain might be 2 to 4 weeks. Moderate sprain, 6 to 8. More significant sprain might be 3 or 4 months, something like that. So most of you are going to get better in a handful of weeks for that particular condition. Now, when you're coming into a chiropractic office, that's pain relief. And there are 3 types of care that I offer in my office, and this is what a lot of chiropractors do. We offer patch care, corrective care, and wellness care. Patch care is this. I want to see you get out of pain as fast as possible. The faster you get out of pain, the happier you are, the more pleased you are with your care. The happier I am at delivering that service to you, we're all happy. Then after that, if you want to, we go into corrective care. Now, corrective care is this. You come in like this. My back is hurting, right? And say 3 weeks, we move you like this, and you're like, oh, my back pain is gone. Thanks a lot, doc. And I say, well, you can stop now if you want. Some people do. We can say, well, maybe we should do some corrective care to bring you back to near normal as possible. That would be phase 2. That might last around 3 months or so, right? And then after you like this and say, wow, Dr. Fuller, this is great. Not only is that patch care pain is gone, now my spine is way better than it used to be. And I can feel lots of differences. Now I'm breathing better and sleeping better, and my blood pressure came down maybe, and I have more energy, and the brain fog is gone, and other visceral improvements that people didn't expect. That happens a lot. Then some people opt to say, okay, now I'm going to come in for the 3rd phase of care, which is called wellness care. Wellness care being, we've worked hard to get you here, now it's time for an oil change. Now it's time for a tune-up. You bring your car in, your car's working perfectly, you bring it in for an oil change to keep it running well. Your car's running great, you bring it in for a tune-up. Same concept. It's running great, let's keep it running great if we can. Car's doing great, you get the wheels rotated around the car, right? Now these phases of care are similar to dental consults that you might get. If you have a more serious dental problem, they might say, well, we have 1 phase of care, and we have a 2nd, and then we have a 3rd. The first phase is we can do some things with your teeth which will give you some temporary deals, but it won't last forever, let's say. The second one is going to be a little more involved, might take some more visits, a little more time and money, of course, but that's going to give you a better outcome. And then, of course, the dentist is going to say, we'll see you in 6 months. How are your teeth? Great, we'll see you in 6 months. Yep, everything checks out well, gums are great, teeth are great, see you in 6 months. Don't forget to exercise your teeth every day. So there's no difference between car maintenance, teeth maintenance, and body and spine maintenance care. That's the type of concepts and care that we have in my office. So how much chiropractic care do you need? It depends. It depends on what you're looking for, but those are the phases of care that we have. If you're watching this on YouTube, give us a thumbs up. Subscribe if you want, and also make a positive comment that might help somebody else. I'm Dr. Scott Fuller. Thank you.